Well, welcome everyone. We're back sitting down here with Dr. John Bachowski, our founder of both Tepeyac OB/GYN and Divine Mercy Care. And this session is really meant to, again, address some of the questions and concerns that we've been coming up, that people have asked us, that maybe you, during this conversation over the next 20 minutes, will be able to share with us any of your thoughts and questions. But a few of you from our last week's session had mailed in some questions, and we want to approach some of those. But do you want to do a quick little overview on the hospital right now, and what's the environment like?
So before that, I just want to thank you all for supporting us, being patients of ours at this time. I'm just so grateful to see all the leopard print shoes that are walking into the office, glitter, just people trying to do little things to help them get through these difficult times. Know that there's a lot of uncertainty, but there's also a lot of hope and just a lot of, we're getting more and more knowledge each week and each day regarding this illness. Our hearts go out to you about anybody who's been exposed, and all the controversy out there about what medications to use and how severe this disease is. And we just want to tell you thank you so much. We're doing our best to stay updated medically, yeah. And I want you to know that you all are in our daily prayers. And the response that we got to our first installment of this video series was very encouraging, and it's really building community and communion during times when it's challenging to do either. So yeah, let's get to that first question.
Yeah, there's so many great questions. But we also have to thank our friends out at Rappahannock Cellars.
Oh yeah.
Rappahannock, along with many other distillers out there. So Rappahannock does wine, but they also do Dita's distillery. And what a lot of distilleries in Virginia have done is converted over their distillery manufacturing into hand sanitizer.
Yeah, Johnny, we thank you from our hearts. This is a time where we have to be innovative, as well as partnershiping, thinking outside the box, because we're not going to get to a point where everything's going to be absolutely perfect. And we really needed some help with hand sanitization, and they just stepped up. Yeah. And we at Tepeyac are incredibly grateful. Not only have they been friends for a long time and provide great wines, but now they're providing this public health service where at times a lot of this equipment is, especially for us on the front line, is in short supply. Yeah. So thank you to Rappahannock Cellars.
Yeah. And if you are a large organization and in need of hand sanitizers, the way you want to go about it would be to go to the Virginia Distilleries Association, and they have a queuing process there. So I would contact them and around that. So if you're an organization that needs larger quantities, that's they've got a methodology of distribution. So
because everything on this virus is kind of current and new, and so a lot of these questions are all over the place. But together, collectively, I'm hoping that it gives you some information where you can really take it to prayer and be with your family during this time, and really maximize the time together with your friends and loved ones, and really help those who are in those high-risk groups. Yeah. So yeah,
So the questions. This one I see a lot on social media and other places, that it's really like, hey, our fathers and or children allowed to be delivered in delivery rooms or labor delivery, or how about after the baby is born? What are the rules around that?
Well, so right now, and we're going to take these pretty quickly here, just to try to get through in the next 20 minutes, so we can start again next week. But the first thing is that this is like any significant flu season. Over the last few years, Inova and most of the regional hospitals have limited only one person in the delivery room, and that person is the person who stays with mom through that time. No children are allowed because of the possible spread, and it's tough. but I think it's a reasonable ask. So one person with you throughout the entire time that they're there.
Okay, great. The next was, is Tepeyac offering any virtual appointments? And how does that work?
Oh, no, absolutely. Not only are we seeing folks here in the office every day, I'm seeing folks today on Friday the 3rd, the Friday before Good Friday, but I've got two phone conversations, two phone consults this afternoon, and we have video consults throughout the day. Just call the front office and we'll get you set up for that. Especially some of these appointments like the basic infertility, hormone consultations, things where you're talking more than examining, or if you have to show us something like a breast mass or lump, they work pretty well, and that's what we're doing, and we're really encouraging it for all of you, especially locals, but also those who come to us from far away. We're still here for you, and we have certain platforms that really get these appointments done well.
Great. Another question here. Are doctors in our area being called to help with the COVID-19 patients, even if they are different, especially if they're not OBGYN patients?
Sure. So no, not yet. Just remember, folks, there are quote-unquote hot spots throughout the country. New York City, a place up in
Detroit,
Washington, and then San Francisco. And now we think maybe Detroit, Chicago, and New Orleans. Not unusual, big cities clustered close together. A lot of folks who are don't have access to many amenities sometimes, and so this area is not quite there yet. We're not even like Denver yet, and so yes, we all have been fitted with the masks. We all have we've gone through the Ebola crisis a few years ago. But no, we're not being asked. And there's really been a good separation on labor and delivery of OBGYN patients and then the rest of the hospital patients.
General pop, huh? Yeah.
And so, no, we haven't been asked yet, but we, like any pandemic or emergency, whether it goes from an airplane crash at Dulles, we're still doctors here. And we still believe that it's a craft. We are professionals, but we believe that there's a unity between body, soul, and spirit, and that we have a duty to serve. And that where many people have become professionals, or they've even become producers of a product, where medicine is nothing more than a financial transaction, we're not there yet. In fact, our family practice doctor who works with us here, he was on EWTN just recently. And so I just want you to know that, no, not yet. We haven't been called to serve because the numbers just haven't gotten there yet.
Yeah. So how about what precautions are being taken to keep newborns at the hospital from contracting this?
Well, it's just very much, it's a lot of good hand sanitization by the nurses, limiting the nursing doctor care, but also keeping the children in with their moms for the most part. Once again, everybody thinks that these nurseries are having cases of COVID-19 positive babies. They haven't. We haven't seen the numbers yet. I know pregnant women haven't. I don't have to tell you guys who are pregnant, but you guys have a up and down immune system. Well, so far, we just haven't seen these incredible numbers of patients positive in the OBGYN world. And then passing on to their baby is even we're just learning about that now. And so far, we haven't seen a lot of transplacental passage of this. I'm sure it will come, but right now, that's what we're doing. Keeping the babies with their folks. Moms kind of know best.
Yeah. That's good. Is there
area hospital?
Hospital that you would recommend?
Well, yeah. I mean, if the people who are most sick are going to Fairfax Hospital, just like they're going to Georgetown, just like they're going to the inner city hospitals, the university settings, the places that have lots of ventilators. But a lot of people seem to be mildly affected. We're just learning now by testing. And number two is the intensive pneumonias. Remember, just so you all know out there, this virus goes after the lung and goes after the intestinal tract. They were talking about a fever, dry cough, and the lack of smell. Those were, and then shortness of breath. Those are symptoms that might occur 3 to 5 or 6 days into the infection. They're also finding that there's a small subgroup, first found in China, but now also found here, with like a long progressive diarrhea and gastric irritation. A lot of it sounds like achiness and general malaise and just being tired. The vast majority of those cases are not progressing to other things. And so we're getting a better handle on right now what the symptoms are.
Yeah, it does seem like it's a mixed bag of,
Yes.
of severity based
Yes.
off of the individual.
And I want you to know that our nurses here have been telling folks that if you really, and once again, on the other side of this, is that not only are we getting better medicines down the pike, like hydroxychloroquine that you hear about, those are encouraging tests. Encouraging. It's an old malaria drug. It's been around forever. Let's see what that does. But we're also getting better tests with nasal swabs and blood tests. They're now distributing them more. So there are a few places in the area where you can go and see if you get those tests. Call up your primary care, and they will send you to they'll give you a phone number to be able to go see if you need to be tested. And I'm encouraged because the number of tests are going up for the rest of the country. They're still trying to take care of those hot spots, which they should, but a lot of the testing is really kind of moving out to the rest of the country.
Good. Another one here that was emailed. They have a relative who is expecting a baby in August. There's several underlying conditions: asthma, poor immune system.
Right, so those are remember, these are the buzzwords. Like this morning, I took care of a lady who had asthma on inhalers, only used when needed, but she also has chronic high blood pressure. She's 40, so in our practice, that's still a young lady who's pregnant. But yeah, she's got some concerns. But this time her baby's growing well, and the placenta looks good, and there's plenty of fluid, and all the problems that occurred with her last pregnancy are not occurring with this one. And so this lady is asking, it sounds like, oh my gosh, this lady is in that high risk category.
She's been feeling exhausted, achy for the past couple of weeks, asthma becoming much worse. Given some of these challenges and unsure whether to should she get tested?
So the first question is, should she get tested for COVID? Because she's in a high risk group and because she's feeling exhausted and we're now having more tests, it's not unusual in a pregnancy to feel a lot of these feelings, the exhaustion, the tiredness. It's a tough call. But she has those other symptoms that put her into the more high-risk category. Like I said, we don't see pregnant women coming down with it. This woman's in her early 20s. This is a great question, whoever sent this in to us. I would probably call I'd call the primary care and get sent for that COVID testing. That's what we would suggest. What symptoms would mean that she needs to take them seriously and get help urgently? Number one, shortness of breath. And I mean like a chest pain. Those are the ones that we see have more pneumonias that can be treated. But it seems to be that's really one of the discriminatory areas is just chest pain. In the old days, they used to call it pleurisy. And so yes, whoever sent that in, thank you for these questions. And I just want to thank you all for being with us over these last 15 minutes or so.
Yeah, I'm just trying to find here anyone who's popped some up online.
We're going to be trying to do these twice a week. Maybe it's on Tuesdays and Fridays, maybe. just kind of depending on what we get.
Yeah, and the schedule.
Yeah.
You're still delivering babies. You're
Yeah,
still in
we
the
all still are
hospital,
delivering babies, right.
It's just a matter of getting your time and getting your.
But please keep looking for these as they come up. We're going to be having them on different topics.
Yeah, and again, we appreciate you tuning in, and again, we're going to have this more frequently, and hopefully you found it valuable. I always learn something new every time we talk, so
Well,
it's good.
And the data's changing, fairly frequently. And I just want you to know that behind everything, the good Lord is always there for us. And please be patient with those around you. Be kinder to those who rub you the wrong way, especially if you're in close quarters, and especially if you're married to them. But in the same token, this is a time to really take care of the body and the soul. Really, make sure you get your relationships right with those that you love your neighbor, but also with your Lord. Take advantage of repenting for things that we have failed on, and really know that there's a bunch of promises in Scripture and in the tradition of the church that God's healing, and knock, seek, and ask, and He's there for us. And I just want you all to continue to get through this time. We're going to be here for you throughout the whole time here. And thank you so much for joining us today.
Thank you.